everyone, and thank you so much. So yes, my topic today, I should have actually covered this back in September. I'm not sure how I missed that. And that is on prostate cancer. And so I'm going to go quickly through that. Actually, I'm not going to get too intense. I know it can be overwhelming a lot hearing a lot about these cancers, but I want you just to be mindful of certain things. And so I'm going to go through a few important items as it relates to that. So what is prostate cancer? So prostate cancer begins when cells in the prostate gland start to grow out of control. The prostate is a gland found only in males. It makes some of the fluid that is part of semen. The prostate is below the bladder, which is the hollow organ where urine is stored, and in front of the rectum, the last part of the intestine. So what causes prostate cancer? It is not clear what causes prostate cancer. Doctors know that prostate cancer begins when cells in the prostate develop changes in their DNA. A cell's DNA contains the instructions that tell a cell what to do. The changes tell the cells to grow and divide more rapidly than normal cells do. The abnormal cells continue living when other cells would die. The accumulating abnormal cells form a tumor that can grow to invade nearby tissue. In time, some abnormal cells can break away and spread, which is called metastasize, to other parts of the body. So what are some of the signs and symptoms? Prostate cancer may cause no sign or symptoms in its early stages. Prostate cancer that's more advanced may cause signs and symptoms such as trouble urinating, decreased force in the stream of urine, blood in the urine, blood in the semen, bone pain, losing weight without trying, and erectile dysfunction. So let's talk about the risk factors for prostate cancer. Factors that can increase your risk of prostate cancer includes a family history. So if a blood relative, such as a parent, sibling, or child, has been diagnosed with prostate cancer, your risk may be increased. So it's okay to also get the genetic testing. And also, if you have a family history of genes that increase your risk, like the BRCA1 or the BRCA2, or a very strong family history of breast cancer, the male may be at risk for getting prostate cancer. Obesity is another risk factor. Older age and race. For reasons not yet determined, Black people, Black males, have a greater risk of prostate cancer than do people of other races. In Black people, prostate cancer is also more likely to be aggressive and advanced. And I believe one of those reasons is that because I've been told by some men that they fear going to the doctors and getting digital rectal exams, and that is part of the diagnostics that is done. So screening tests for prostate cancer. The screening tests discussed here are used to look for possible signs of prostate cancer, but these tests can't tell for sure if one has prostate cancer. So let's talk about the prostate-specific antigen blood test, the PSA. The change of having prostate cancer goes up as a PSA level goes up. There is no set cutoff point that can tell for sure if a man does or does not have prostate cancer. Many doctors use PSA cutoff point of 4 or higher when deciding if a man might need further testing. So men with a PSA level between 4 and 10, often called the borderline range, have about a 1 in 4 chance of having prostate cancer. If the PSA is more than 10, the chance of having prostate cancer is over 50%. Other exams that they've done is what I call the digital rectal exams. And that's where the doctor inserts his finger to feel the prostate and feel if there's anything that's going on. And most African-American men have been told, I can't say for sure, that that's one of the reasons they don't go, because they don't like that exam. They feel it is uncomfortable and they don't want to do it. So I'm imploring you to make sure that that gets done. As uncomfortable as it is important to get it done. So screening test for prostate cancer continues. So are there factors that might raise the PSA levels? The answer to that question is yes, such as an enlarged prostate. Conditions such as benign prostatic hyperplasia, BPH, and non-cancerous enlargement of the prostate that affects many men as they grow older can raise PSA levels. Older age, PSA levels normally go up slowly as you get older. and if you have no prostate abnormality. Prostatitis, this is an infection or inflammation of the prostate gland, which can raise the PSA levels as well. Ejaculation, this can make the PSA go up for a short time, and this is why, and I'm highlighting that, some doctors suggest that men abstain from sexual intercourse for a day or two before getting tested for prostate cancer or being screened. Riding a bicycle, some may not know that. Some studies have suggested that cycling may raise PSA levels for a short time, possibly because the seat puts pressure on the prostate, although not all studies have found this. Certain medications, taking male hormones like testosterone or other medications that raise testosterone levels may increase and may cause a rise in the PSA levels. So treatment options for prostate cancer. For people with slow-growing prostate cancer, the doctor may do an active surveillance. Some prostate cancers grow so slowly, they usually will not cause problems. Doctors will regularly monitor the slow-growing tumor for any sign if it is changing. They also do surgeries and radiation therapy. Other options, if there's a risk of prostate cancer spreading to other tissues next to the prostate or lymph nodes, doctors may combine treatments such as hormone therapy, brachytherapy, and external beam radiation therapy. Prostate cancer that has spread outside the prostate, these are treated with several systemic therapies, and they include the hormonal therapies, chemotherapy, genomic-based therapies based on genetic information, immunotherapy, radiotherapeutics, biologics, and clinical trials. A medical oncologist expert will decide which treatment are best for patient and the kind of prostate cancer they have. So what are the complications of prostate cancer? Let's look at treatments. Cancer that spreads, so metastasize, right? Prostate cancer can spread to nearby organs such as the bladder and travel through your bloodstream or lymphatic system to your bones and other organs. Prostate cancer that spreads to the bones can cause pain and even broken bones. Once prostate cancer has spread to other areas of the body, it may still respond to treatment and may be controlled, but is unlikely to be cured. Incontinence. Both prostate cancer and its treatment may cause urinary incontinence. Treatments for incontinence depends on the type you have, how severe it is, and the likelihood it will improve over time. Treatment options may include medications, catheters, and treatments. Erectile dysfunction. Erectile dysfunction can result from prostate cancer or its treatments, including surgery, radiation or hormone treatments, medications, vacuum devices that assist in achieving erection, and surgery are available to treat erectile dysfunction. Let's talk about some of the statistics. It's believed that 1 in 7 men will be diagnosed with prostate cancer in their lifetime. 68% of men know someone who has prostate cancer. 42% of men weren't familiar with the warning signs of prostate cancer. 25% of men said they never discussed a prostate cancer screening with their doctor. And globally, more than 1.4 million men are diagnosed with prostate cancer on a yearly basis. Some more to know, it is more common than we think. Silence isn't always golden. You have options. Knowing where you stand matters. Easy to stay ahead of the game. Number of new cases of prostate cancer per 100,000 men. White men, 105. Black, 178. Support groups. There are many support groups out there, but these are just a few. The Myriad Genetics, cancercare.org, NewYorkPresbyterian.org, mailcare.org, the Prostate Cancer Foundation, and ZeroCare.org. I want to give special acknowledgement to the American Cancer Society, Memorial Sloan Kettering in New York, Mayo Clinic, cancerresearch.org, and cancer.gov for the information that I provided you today. I hope this was helpful, and I implore our men to please get yourself screened and checked. As scary as it is, getting a diagnosis is even worse. God bless. Enjoy the rest of the service. Please join me in the Zoom room should you have any questions, and I'll be happy to answer them for you. Have a wonderful rest of the service.